mHealth, the intersection of mobile technology and health. Widespread recognition exists for mHealth technology's potential to address and overcome disparities in health services, health inequities, shortage of healthcare providers, and high cost for healthcare. mHealth falls under an umbrella of eHealth, or the broad use of information and communication technologies to support health and health-related fields. The World Health Organization's Global Observatory for eHealth defines mHealth as medical and public health practice that is supported by mobile devices like mobile phones, patient monitoring devices, PDAs, personal digital assistants, and other wireless devices. mHealth technology comprises a wide range of tools with various technical capabilities and functionalities to support health-related programs. mHealth's frequent use in programs is due to a number of reasons. It is more economical than a phone call. SMS is versatile as it can be sent, stored, or answered. It is retrieved at the user's convenience. And the messaging system is available on all phone devices. Mobile apps are important mHealth tools for smartphones and tablet mobile devices. mHealth has grown from an emerging field to a mainstream component of eHealth activities. Some of the driving forces for the mHealth movement include technology, the consumer and patient engagement movement, global health or connected health, and policy, research, and business. Ubiquitous access to mobile devices and with their range of functionality and increased capabilities are some of the reasons of the rapid growth of mHealth. Although mobile phones in the United States is similar across ethnicities and community types, there are noted differences in how access to the internet is obtained in the United States. Minorities rely more on their phone for internet access. The functional capability of mobile devices has increased with each smartphone generation. The use of mobile devices is transforming lives by changing the way people work and interact. Healthcare models are changing through patient engagement and empowerment. This increases collaborative care and changing the roles of both the consumer and the provider. Access to healthcare systems in either rural, isolated, and resource-limited settings is a major driver of global mHealth implementation and research. The World Health Organization has recognized mHealth as a tool for strengthening healthcare systems and improving healthcare outcomes throughout the world. There are two important guides providing principles for mHealth intervention, development, implementation, and evaluation. These are the Guide for mHealth Development, Design and Testing, and the Principles for Digital Development. A common purpose for both of these guidelines is to build a common strategy to mitigate any overlap, waste, and improve collaboration among the key stakeholders at the local, regional, and national levels. After the rapid surge in the number of mobile phone apps that are available to the public, the FDA released guidelines on mobile medical apps in 2013. The agency did indicate that it will oversee a targeted risk-based subset of apps to focus on patient safety for cure, treatment, or the prevention of disease. Healthcare systems globally and in low resource settings has made mHealth the potential to increase the healthcare quality, decrease cost, and create additional capacity for healthcare systems. Service costs, which are traditional provider visits, are projected to significantly decrease with digitalization of healthcare services. mHealth has evolved from the early clinical decision support at the bedside using PDAs to the use of personal supercomputers. mHealth tools have the potential to support the consumer or the patient in being better informed and more involved in their own healthcare. Mobile phones can support patients so they can actively participate in their care and be aware of their health through active self-monitoring. Sensors have the potential to provide real-time measurements with highlights in day-to-day variations. Challenges are the issues of human resources, funding, infrastructure, and privacy. Concern does exist that mHealth consumers may misinterpret their data or rely on information from apps or devices without consulting a professional. Data security, privacy, confidentiality, and human protection are major concerns for mHealth adoption and expansion. Large amounts of data are being collected on multiple devices and transferred elsewhere for a central data collection and analysis. The next generation of mHealth will be using 5G, and it is likely to revolutionize and transform healthcare. The level of connectivity will enable reaction times that can support the precise control of autonomous vehicles, improve network reliability, and reduce the energy use. mHealth is changing the delivery of healthcare through its continued role in the future of global healthcare delivery.